During the last 5 weeks, we have seen in Montreal a constant increase in the number of new cases each week. It is not a rapid increase, but it is constant, and now we're having an average of 250 new cases each day. We're at the same level or at the peak that we had at mid-September during the fourth wave. Of course, the new cases are mainly, and the rise is mainly among the population that is not vaccinated, and mostly the 5-11 years old group, and the group that can be referred as their parents, the 35, 55, 54 years old group. And we're seeing an incidence rate higher in the population that is not, of course, vaccinated. We're seeing also an increase in our positivity rate, and some neighborhoods are more affected than others with the 5% of positivity rate, higher than 5%. We're talking about Anjou, Saint-Léonard, Pointe-aux-Trembles, Saint-Michel, et Côte-des-Neiges. The good news is even though we're seeing this increase in the number of cases, and we know we're isolating a lot of persons, it is not always easy to live with, we're not seeing an increase in the new hospitalization and new admission in intensive care units. So this is quite positive, and we'll see in the couple of in the next weeks if we're seeing more severe cases. We're currently managing more than 180 outbreaks, active outbreaks. 55% of them are in schools, primary school mainly, and daycare centers. We have a few outbreaks, small outbreaks in workplaces. We're seeing a reduction in our outbreaks, only 3 in healthcare setting, and we still have 7 active outbreaks in homeless shelters. Concerning the Omicron variant, of course, at the time we're speaking, and we have a lot of information in the news. We do not. We know a little on the characteristic of this variant. Is it more transmittable? Does it give more severe illness? And does it escape immunity that is conferred by the vaccine? So while we are waiting for this information, we have to be vigilant, and this is what we are doing at a national level, at the provincial level, and regionally. At the time we're speaking, we have one case in Montreal that was confirmed. It was a traveler. The person is in quarantine, and all its family contacts are isolated, so we're not expecting to have secondary cases or community transmission associated with this case. And we're doing a surveillance of 50 travelers that came from the countries that are where we have community transmission. So we're quite happy with the measures that have been announced by the federal governments for the countries where there is community transmission, but also for all travelers with screening tests, isolation while people are waiting for their test. So I think it is prudent. We're increasing our capacity of surveillance with criblage and testing, making sure that we will catch them rapidly. And we're going to do as we have done in last spring with the Alpha variant. We're going to put a suppressive approach when we have a case. That means that we will not have the same approach that we currently have with the Delta variant. We will be more aggressive. We will isolate contacts even though they're double vaccinated, and we will do so till we have more information on this variant. And we have this objective, of course, to postpone us to make sure that we postpone the time the variant enters community transmission. Concerning vaccination, we're at the first week of our vaccination campaign for the 5-11 years old. We currently have vaccinated 14% of this population, but we have a third of this population that has taking their appointment. We're working, of course, we saw this morning in the newspaper, we will have some differentiate approach because of our capacity, but of course we know the neighborhoods where we have to do more efforts. We know the schools where we will have to reduce barriers because of different social inequalities, and we're working with schools and CIUS to make sure that we will have the best coverage for all population, and we will reduce health inequalities. So we ask the population if you are able to go in a massive vaccination center, take an appointment as soon as possible, because and your child will confer immunity rapidly for holidays. So this is our recommendation. So I think we have a vigilant approach with the variant, but we are not at a stage where we have to panic. In Quebec, we have a high coverage rate, vaccine rate. We haven't lost good habits for masks in public places, for this distanciation, and I think this is why, yes, we're seeing an increase in the number of cases, but we were expecting it with fall. But at the same time, we do not have the consequences of higher hospitalization rate in our healthcare facilities. So we ask people, continue to get your appointment if you're not fully vaccinated. If you have symptoms or are in contact, go get a screening test, and of course, wear your mask indoors. Thank you.